tonight is, how does your posture indicate how stressed you are? And these are things you can look at subconsciously and just, it's showing you how the body is and how you can see how sick somebody else is just by their posture. Now, these are real simple things. So there's one main cause of all disease and all dysfunction. Now, if you talk to a symptom person, they'll say that's not possible. But there's one thing, and it's your inability to adapt to your environment. Now, what does that mean? Stress. How do you adapt to stress? If you adapt correctly, you can go through any kind of environmental factor and be okay. Well, let's some of them, like obviously if you're shot by a bullet or you're exposed to a nuclear radiation, there's certain things. But even with that extreme radiation one, we've seen in places like Chernobyl where one person will get cancer and the next person standing right beside them won't get cancer. And the exposure was not the cause of the cancer, it was the inability to adapt to the toxin or the radiation. So that whole adaptability will come down to, and this is the interesting part of the body is completely a binary system. It's really on-off, good, bad. And that goes up until you get to like the brainstem, and then it starts getting into gray areas. But below that, it's on-off. So does the reflex work or not work? Is the body doing the right thing or not doing the right thing? Then when you start getting into the cortex or the brain, then it can do gray areas and it can mediate it and turn it on or off. The reason why I bring this up is when you look at the body's ability to adapt, it's about can it adapt or change proportional to the stress it's under. So if somebody is driving down the road and flips you off, do you rear end them because you're angry? Or do you just go, he or she is having a bad day? And that's realistically what we got to look at. And that's just one of them. That's just emotional stress. Or do you yell at the television when there's people on TV talking about what they're going to do? Like the elections.
Yes.
Do you, or what do you do? Like what exactly is going on here? Why are we doing these things? And what they are, and the interesting thing is let's take the real easy one, the funny one. The people yelling at the television because Trump or Hillary said something bad. And literally what it is you got so angry because you couldn't adapt correctly that you, to get a relaxation feeling, have expressed anger to make yourself feel better. This is actually a form of an addiction. It's an anger addiction. And we'll see that in different people. Other ones will use drugs and alcohol and different things, but that anger addiction will be the way to see what's going on. These different addictions people have are letting you know that they're stressed out. If they're yelling at people, they're stressed out. And we know that, but we don't know that when they yell, they get a dopamine rush and then they feel good. When they drink their booze, they get a dopamine rush and they feel good. When they do their gambling, when they do their different curricular activities that are not best for them, that's what they're getting their payoff because they've been in such a stress state. So that's one indication that person is in such a stress state that they can't adapt. So you go, well, why is that gambler addicted to it? Or why is that person addicted to heroin or this or that or the other thing? It's literally because their body is in such a state of stress that the only way they can get a payoff where their brain will feel calm for a couple minutes is to use that substance or that emotion to calm them down. That's one indicator. Now, here's the one that everybody knows but doesn't understand what it's indicating. If somebody comes up behind you and they rub your shoulders, what does everybody go? Oh, they all melt down, right? That right there tells me you're not adapting. If you feel relaxed when somebody just touches your shoulders, it means you are in a prolonged stress state. And here's the interesting thing. This is a neurophysiological response, and this is a big one. The first thing your body does if you get scared is pulls your shoulders up, and that's literally an on switch for stress. It's that simple. Turn on stress, pull the shoulders up. Turn down the shoulders, pull them down, stress goes away. And you can literally see this on biofeedback, because you can take somebody, give them a little massage on their shoulders, push them down, and you can watch their heart rate drop. You can watch their hands not get sweaty. You can watch their temperature increase. You can watch their respiration rate drop down. Because the shoulders going up is you dialing up stress. So you see those people walking around like this? They're pissed internally. Internally. It means they're not doing well. The other one that the body will do, and most people aren't aware of this, some chiropractors are, and they looked at it through a mechanical way, but this is the other thing. If you're stressed out, your body has to learn how to adapt to the environment around it, so it has to be on a hyper awakened scale or ready to go. So have you ever had one of those elastic bands and you stretch it and it starts to losing its elasticity and then you gotta stretch it more and stretch it more? The body does the exact same thing with the spinal cord. The exact same thing. So if you want to know why people, and if you've gone to chiropractors who talk about curves, if you want to know why the curve is gone, it's because you're stressed and the body is literally putting more and more and more and more tension on your spinal cord, leading to you reacting quicker. And I've seen this. I had a patient, and when he first came in, he was like this. He was a little forward, then he got in a car accident, and he went forward. Then he got in another car accident, and he went forward. Then he broke up with his girlfriend, and he was literally walking in like this, with his head pushing forward. Now what's going on here is the body is under so much stress that it has to still be aware though. So what happens is you get used to it. So if you're awake and wide awake, but your stress level is say at 10, but you still got to be able to react to more stuff and another big stimuli comes in, like somebody breaks up with you, then you have to get to a new level of adaptability and stress. So it's not positive, but what your body does is literally it stretches your spinal cord more, so it takes less energy to make it get into a reaction state. So what does that mean? The farther your head goes forward, the longer you've been in a stress state. The longer you've been growing sickness. Now, the side effects of this is that we know that each inch your head goes forward, you literally lose between 5 to 10 years of your life. Insurance actuaries figured this out. So they figured out the farther your head forward is, the more they add on for age. So if it's an inch, 2 inch, 3 inch, 4 inches, it exponentially grows. It also grows in the amount of weight that's on the spinal cord. But the body's doing that on purpose to allow you to adapt quicker. So how I'll explain it is like the elastic band. So we stretch it, and then it's not elasticy anymore. It got kind of flaccid, so we got to stretch it again. That's what your body's doing to make your nerve system fire quicker. Because you've been under all this stress, and the stress stays high, and then you're under more and more and more and more. And what will happen, this is the interesting thing that most people aren't aware of, is that if you push it long enough, for the body just to rotate, it'll actually collapse discs on itself. So the disc compression or collapsation is actually a self-inflicted thing to allow it to adapt when it needs to relax. The disc herniation is the body's way to adapt to the spinal cord being so stressed that it can take a little bit of pressure off of it. Isn't that crazy?
That is crazy.
So the body made the disc herniation. The body made all these issues, and it's not adapting correctly, and that's why we're seeing that. So I know I went off on a little thing, but this is what we want to look at. Are our shoulders always tight? If they are, chronically stressed. And this doesn't mean we feel chronically stressed. Because I have people come in here and I do my stress assessment on them, and I go, oh yeah, I'm perfectly fine. And literally their heart rate's at 90 beats per minute. Oh, that's normal, doc. Really? Oh, it's normal to have tachycardia and you can barely breathe and everything's going crazy? Oh no, that's my life. That's normal. That's just me. I'm like, no, it's not just you. It's how you've adapted to your environment. And we'll see people that are addicted to these things. I have some patients that I take care of, and I'll hear crazy things. Like, my hands are dry because I wash dishes. And I'm like, okay. And they're so stressed out they don't understand that they've literally turned off the ability to sweat. So when your hands sweat, it's because you're stressed out. And if you've been stressed for a long period of time, specifically emotionally, then your hands get dry. So if you're one of those ladies that puts a lotion on your hands, it means you're chronically stressed, growing sickness. I'm sorry to be the bearer of bad news, but that's literally what it means. Or do we have cold and dry hands? We're really trying to get sick. And that's literally what it comes down to. And you're like, oh no, cold hands, warm heart. No, cold hands, heart's gonna have a heart attack. That's literally what happens. Is that we literally cause it to pump so fast that we're gonna have a heart attack or a stroke or get rheumatoid arthritis like a lot of women get. And it's all a byproduct of stress. So if you wanna know if you're healing and the modality or whoever you're going to is helping you, see if your hands get warm. Do they get warm? Do they start to warm up after you get adjusted? Or did you get seen? Do they start to actually sweat? Do they start to actually work correctly? These are physiological factors showing that you're healing. If you have cold hands and cold feet, if you have dry hands, or you're one of those people who has, and you see these commercials now, do you have sweaty palms all the time? Take this drug. They're literally turning off your nerve system. That's what's going on. Let's turn off everything so you won't have sweaty palms. That's literally what's going on. So if you have really sweaty palms, it means your body is in a stress state. So sweaty hands, cold feet, stressed out, growing sickness. No ifs, ands, or buts, it's that simple. The next one is, and then we'll see this. So I'm gonna ask a couple questions. So if I walk into a room and I'm like this, am I happy or sad? Am I stressed out or relaxed?
Relax.
I'm relaxed, right? What if I'm like this, in a corner or on a table or anywhere? I'm stressed out, right? And this is a physiological response we've learned since birth. Because we're in the womb and we're in that C shape, and that C shape is how we're born. We have two primary curves when we're being born, and that's just the mid-back and the lower butt. We're just in a C shape, and that's our protective, makes us feel calm and protected state. So what happens with that? Number one, we pull our shoulders up. Remember, that's the light switch that turns on stress. So if we pull our shoulders up, here's what it does. It instantly turns on what's called the parasympathetics, and it causes your heart rate to go up. It causes your respiration rate to go up, so your heart goes fast, you breathe fast, your adrenaline and insulin and cortisone levels all spike. All of these things are a byproduct because you went like this. So if you want to get really stressed out, and there's certain times you need to, like you go to the gym and you want to pump iron really good, start go like this about 5-10 times, and you will lift more weight than you usually ever lifted, because you literally turn on adrenaline. But if you want to turn it off, that's a whole nother ballgame. Because the problem is that we've learned to breathe like this. And we're like, oh no, I'm just a shallow breather. No, you've been stressed for so long that you've taught yourself this is the only way to stay stressed out. And you're like, but, well, I grind my teeth sometimes. Oh yeah, that's another one. We're so stressed out we can't relax. So, are we using this? Do we have tight shoulders, cold hands, cold feet, sweaty hands? Here's another one. Do we have knee problems? Knee problems indicate chronic stress all the time. And you go, well, what does that mean? Let's think about the postures. This is a defense posture. What happens is this hamstring muscle gets really, really tight. You always hear about people ripping their hamstring. They don't usually rip their quad. Maybe 1 out of every 1,000 people rip their quad, right? It's always hamstring. Chronic stress. It causes you to get in a defense posture because you don't want anybody to get you back there, so you got to protect yourself. So you get this tighter, and guess what happens to your knee? This is your leg. You pull it back, and then you start walking away on it, and they go, oh, you got bone on bone, you got blah, blah, blah. You got stress causing your knee to go out of position. And then, you know, if we put a fake one in, you can't feel it anymore. And then you can walk around and it'll wear out in 5 to 10 years, and then you get another fake one. Now here's the one thing, I'm going to go off topic here for a second. Here's the one thing that most people aren't aware of. You can only get 3 replacements of any joint, and then you're done. After the 3rd one, you don't get any more because they've reamed all the bone out so many times, it's very rare to get to a 4th one. So that means if you get one, and the average length of time is 5 to 7 years. If you're really good, you'll get 10. So if you start at 40, that means by the time you're 70, you're in a wheelchair if you get knee replacements. And you can look this stuff up, it's all in the medical literature. It's a short-term fix. Why don't we change the way your body's stressed, and then your body can heal itself? That's the key. So, if we chronically pull hamstrings, if we have low back pain, we're stressed out. And this is all an inability to adapt. So, we get really stressed out, and what happens is this. When we're normal, we're supposed to be like this. We're supposed to have a curve in our back. When we get stressed out, our hamstrings get tight, and it pulls our back straight. And so what happens, instead of having a nice curve in our back, it flattens it out, and then you get disc issues, then you pull on the spinal cord more, you get all these problems. And the funny thing is, and this is literally what I did. I had a 25-year-old man come in here. He goes, "Doc, I think I need an MRI." And I go, "No, you don't. You're 25, you're fine." No, I'm sure I got an MRI. I'm sure I ripped it, da-da-da. And I go, "Okay, just humor me. Do diaphragmatic breathing for 2 days, and if you're not at least 80% better, go get an MRI." After 1 day, he phoned me back and said it's 90% gone. Now, why is the breathing so important? And the breathing is so important because it forces you to relax. It forces you to relax. It forces you to relax. I know I said it 3 times because you gotta hear me here. You need to relax. "No, I'm relaxed, Doc, I'm good." And you'll see people walking around like this. And you hear those ladies go, "I don't want that Dowager's hump, I don't want that old hump." That's because they're so stressed, they're walking around like this. And you see them, they walk around like this. It's because their body has been stressed for so long, it's literally acclimatized to that being normal. That make sense? So what do we need you to do? We need you to, every time you breathe, which is 12 to 25 times per minute, train yourself to relax. So if your base of propagation of how you're going to be is stress because you're breathing like this, are we going to get better? No. We're going to go, "Well, no, I don't move my shoulders, Doc. I know that. I'm just making this extreme." If you only breathe from your chest and your lungs, if your ribs move, you're breathing the wrong way. If you only breathe through your tummy, it will force you to relax. And you'll literally start feeling things like, "Oh my God, this is awesome."
And that's
I
how
can-
you say it?
yeah.
"Oh my God, this is awesome."
I can feel my hands. They're warm for the first time in 40 years. Yeah. It's this simple. It's literally this simple. Now, there's one thing that may happen, though. If you've been in stress for so long, your body has acclimatized itself to learn that stress is normal. And if you try to relax and breathe, it will put you into stress states subconsciously. It'll make you start thinking about bad things that stress you out. Like your mom, and what happens is your body is addicted to the feeling of protection. So what do we need to do? We have to gradually get you in there. We work on it, we work on it. And each time you do that breathing, you're actually training your brain to fire a different way. You're training your body to become addicted to a new feeling. If you've been stressed in a long period of time, there may be a couple months where you don't feel awesome. And I'm just going to tell you that straight up. The reason is, the definition of an addiction is when your body runs itself and not the brain. So, I take care of addicts. I take care of, right now I've just weaned a lady off heroin who's been a 20-year heroin addict ever since she was 16. And we have ways to help people get off hard drugs like this that have been scientifically proven, and it's all about changing the way the brain actually communicates. So the cool thing is that every 280 days, you have a new brain, you have a new body. You make everything again. So every 280 days, if we slow the stress down, the new cell is addicted to relaxation. The new cell is addicted to relaxation. The new cell, and you'll get to a point, and it'll be your day. That I love these days. You come in and you go, "Everything changed, Doc." And I go, "Awesome. That means we've changed enough of your body that the new way of being is relaxed. And it's not the old way of being." And then it starts taking over. That's my ultimate goal, is to get you to the point where there's more health than sickness or bad or whatever you want to call it, and you're adapting correctly. And when that happens, you become so vibrant and energetic because you're not barely getting by, you're thriving. You're not barely getting by or just have enough to do this or that, you're relaxed and you're just in a good state. You're not barely getting by. You're not just slugging through the days. Oh, I just gotta do it. No, you come home and you do whatever you want to do, and you have energy, and you go out and you do the things you want to do, and the sports and the kids and all the stuff you want to do. That's why I do what I do. Because when we see you change and you become adaptable, then you heal. This is so big that I've actually gone after a big grant to try to change poverty, to help people be able to see the world for what it is and not how they're stuck. And you can see this easily. If you've ever had somebody yell at you or been in a car accident, you shut down. And when you're in a high stress state, you shut down and you can't see everything for what it is. You just see it for this one or two simple things in front of you. And so what we want to do is me personally and my community is uplift people to a point where they're more adaptable than their stress level, and then you may start making conscious ideas and decisions about what's around you and not just I need to get by. And if you talk to people who are in a depressed or suppressed environment, like, why did you steal the bread? You could have went here. I didn't even think about it.
Mm-hmm.
Why did you do that? I didn't even think about it. It's because you couldn't adapt. You couldn't think. You're on a one-track mind. I need this and I got to do this thing. Or I need this and I got to do this thing. And you'll see it, and you see it everything from the crazy stuff like sex trafficking to people in ghettos to like all these things. It's because you're so stressed out that your body can't adapt. So you're just thinking on a basic rudimentary function, which is I need food, I need protection, and that's all I need. I'm just doing basic things. It's called the mammalian brain or the mammalian thought process. So what we want to do is get you out of that. And then what we see is all of a sudden you have more energy and vitality because now you can start using energy sources that you've been using just to get by. And you see these in countries, you see this in different things. If you're just on a barely getting by, you'll never have enough. If you're just, I just need to barely make this paycheck, do this, do that. But if you're in a thrive environment, then that doesn't even exist anymore. It's like, I want to just have enough energy to go work and come home. Or do you want to go home, come back, and have a ton of energy? And it just changes your perspective. So what we do through the adjustment is make you have more basically resources to find things, to think differently. So my goal is not to make your pain go away, even though that's a side effect. My goal is to make you so adaptable and so resource positive or rich that you start doing things that you don't remember yourself doing since you were 13, 14, 18, 20, whatever it was. You start having vitality and energy at high levels. So when you see people, and I'm going to go off topic and come back, that have that head going forward, they're stressed out, they're getting sick. When you see people that have their shoulders up all the time, stressed out, getting sick, you hear about people that chronically have low back pain and chronically have hamstring issues. What they're doing is this is a symptom of stress. When they come to the chiropractor adjusts them, and it's not the adjustment of the spine that changes them, it's the adjustment of the brain. Because the adjustment of the spine actually pulls in neurofeedback and breaks the loop of stress you're in, and that's why you get better. That's why chiropractors can do adjustments where they adjust only one segment up here and your feet feel better. Only adjust one segment up here and your low back pain goes away. Only adjust one segment up here and your uterine, your fibroid, you name a disease and it goes away. Because it's not the adjustment that is healing you, it's the changing of the brain and the adapting to your world around you that allows you to change. Because if we don't change your perception, and that's literally what we do, when we showed some psychologists what an adjustment would do, they literally fell off their seats. And I'm not lying, they literally fell off their seats. And these are the people that do bio and neurofeedback. They said, it's not even fair what you guys have. It's not even fair. Because what you guys can do in one adjustment with neurofeedback takes us 200. 200. And if you know anything about this, this is literally radically changing lives. So what the neurologists or the neurofeedback people, the psychologists have shown, and then what they stated is whenever you have a frequency that changes or crosses over, such as a beta where stress is, an alpha, more relaxation, a theta, more, whenever those change and cross over, you instantly change that person's perception of the world. That's verbatim what these people told us. Guess what each chiropractic adjustment does? Changes your perception of the world, and you become more energy rich, and now you have more products, more vitality, and more ability to reach out and do the things you love, or deal with crazy people or crazy things. Because yes, there is dealing with things still. Don't get me wrong, it's not like I adjust you and now there's rainbows everywhere and nothing wrong happens. No, you still have craziness out in the world, but the cool thing is that now we'll call you patient 1.0, you're now your patient 2.0. And then 3.0 and 4.0 and 5.0, and you keep building. And the cool thing is with the adjustment, we make your brain faster. You know what I'm saying? Make your brain faster. So if we make your brain faster, that's why you can deal with things better. So, to recap, shoulders, head, cold hands, cold feet, sweaty hands, or really dry hands, sick. Always have low back pain or tight hamstrings, sick. No ifs, ands, or buts, you're growing sickness. They go, oh, well, I don't have any symptoms, I'll just wait until something pops up. Excellent. So wait until your car breaks down and the engine blows up before you're going to change the oil. That makes perfect sense. Wait until something just completely falls apart. Here's the deal. I'm going to make it real simple. Real simple. You are going to pay for your health care one time. Now, you're either going to pay for your health care a little bit over a long period of time, let's say $10,000, or you can be like average America. And average America goes bankrupt in the last 6 months of life and spends over $250,000 because they do not actually take care of their health. They wait until a symptom comes up. If you do that, you're waiting until your body blows up. No questions. That's what you're doing. If you want to do that, that's fine. I recommend, though, that maybe you spend 5-10 grand over your lifetime, and then when you're old, you can give that 250 grand to your grandkids, to your family, and you can have fun. You can be on a yacht, on a cruise, having fun, instead of in a nursing home with dementia and all these different things that are drug-induced and having these issues. And it's choices. It's really simple. Do you want the red pill or the blue pill? Do you want the apple or the cheeseburger? It's really simple things. And it's just, and this is the funny thing, there is no silver bullet. There is no one thing that will make you healthy beyond everything. It's a conglomeration of everything. But I will tell you, if your brain can adapt correctly, it will help you deal with every facet of society correctly and every facet of stress correctly. So if you do a simple thing daily, then after 2 to 3 years, you're a different person. If you do a thing incorrectly daily, then after 2 to 3 years, you're a sick person. And it's really that simple. So you want to decide, do I want to invest in me so that when I'm older, I'll be okay? Or do I want to invest in medicine and see how sick I'm going to get and if I can barely get by? The biggest growth of population right now in our country and the world are called centurions. They're people that are living over 100 years of age. And they all said the same thing. I didn't think I'd live this long. I wish I would have known then what I know now. Well, I'm telling you right now what you need to know. And the answer is, if you invest in you right now, when you're 60, 70, 80, 90, 100 years of age, you'll have vitality and health. If you don't do it now, don't come and say, nobody told me, because you got the answer. Good luck.